We have with us Dr. Neha. She's joined us. Yes. Welcome to our live session, Dr. Neha. It's a pleasure to have you with us. So let me give a brief introduction before we start with the session. Dear audience, Dr. Neha is the consultant pathologist in our Noida Redcliffe labs. It's a pleasure, ma'am, to have you with us as we discuss with this beginning of 2025, as we discuss the power of staying healthy and fit through preventive care. We would like your expert insights on it and understand how we can make this year a healthier one by making precautionary measures in advance. So, ma'am, in fact, our audience out here, our patients and our customers, they all would want to know, why is preventive care so important?
See, basically, preventive care is taking steps to reduce a person's risk of developing a disease or an illness. So basically, in other words, that would mean you prevent a disease or illness before it occurs. So, by doing that, you not just improve your overall health, but your quality of life, your life expectancy, and also you delay the onset of various chronic health conditions and the complications that would arise due to it. So you help in saving the cost also, which otherwise you would incur in the treatment of these conditions. So this you can do by various ways, especially by regularly getting yourself checked with the clinician and by regularly taking, blood tests. Also by maintaining a healthy lifestyle, by eating healthy, exercising regularly, quitting smoking, reducing alcohol intake. So by these few measures also, you can prevent the onset of various clinical chronic conditions.
So there is a saying, I have heard that, people believe that, trying to stay fit and healthy, it's very, very costly. Wellness is very costly, they say. But then somebody added out there to this line that if you feel wellness is costly, then try illness. Illness is even costlier with the number kind of bills that we have at hospitals nowadays, and with the kind of, whenever we are going for medicines, medical checkups, diagnostic tests and all, there's a long, like, people are actually scared to get themselves tested because of the bills. How through preventive care we can avoid such criticalities or chronic diseases?
See, preventive care is basically a long-term investment that you are making on yourself, because it will not just help in identifying these medical conditions early, but it will prevent the complications also. It is the complications where you incur the huge bills. So by regular checkups, you can save a lot of money in the long run. Also, the complications reduce, so there is reduced hospitalizations, so you cut down on the hospital bills, and you reduce the need for surgeries or any invasive procedures. Plus, so basically you are reducing the long term needs, where you will incur a lot of expense by just taking some preventive measures like staying fit, eating healthy, and getting yourself regularly checked.
एब्सोल्युटली वेरी ट्रू. हम कभी कभी क्या होता है कि हम लोग क्या करते हैं, जंक फूड मतलब इजी होता है, पैकेज्ड फूड जो इजी होता है, प्रोसेस्ड फूड जो इजी होता है, हम लोग ऑन द गो ले लेते हैं जस्ट टू अवॉइड गेटिंग इनटू द किचन. कुकिंग स्पेशली ड्यूरिंग विंटर्स बहुत डिफिकल्ट हो जाता है. बट ये जैसे आपने मेंशन किया कि इट्स एक्चुअली अ प्रोसेस जब दैट वी शुड फॉर्म इनटू अ हैबिट. So preventive care does not just mean that जब आपको कोई बीमारी हो तब आप हॉस्पिटल जाओ. प्रिवेंटिव केयर मीन कि आप अपना ख्याल एज अ हैबिट रखो, अच्छा खाओ, एक्सरसाइज करो, टेस्ट करो अपने बॉडी को, and in the process आप healthy रहोगे. So dear audience, I was like, before you joined, there was somebody who said that being fit means when you can eat anything and still fit in properly. So yes, nobody should restrict you from doing anything, but it's important कि आप अपना ख्याल रखो ताकि आप कुछ भी कर सको अपने लाइफ के साथ आप इंजॉय कर सको एवरी मोमेंट, तो वो बहुत इंपॉर्टेंट होता है. बट मैम वी हैव आल्सो सीन दैट जो कहते हैं कि एज वी एज देयर आर सर्टेन रिस्ट्रिक्शंस दैट वी हैव, लिमिटेशंस हो जाती हैं. जो एनर्जी जो एक बच्चे में होगी, वो शायद ऑब्वियसली अ पर्सन हु इज इन हिज 60s और 70s उतनी एनर्जी नहीं हो पाती है, तब वो इतने फिट एंड हेल्दी नहीं रह पाते हैं. तो कौन से ऐसे प्रिवेंटिव मेजर्स एंड केयर हैं जो एज पर देयर एज ग्रुप्स पीपल शुड टेक दैट विल हेल्प them stay fit overly, know their body, know their health issues and problems, take precautions in advance and stay fit in the long run? कौन से ऐसे routine checkups है as per the age groups that should be taken?
See, in children, we usually do not recommend any sort of preventive test unless they develop some symptoms. So basically, these preventive tests, we start recommending them usually from the age of 20. Nowadays, because we are seeing a lot of, especially sudden cardiovascular events in the young. So usually we start recommending all these preventive tests and these preventive health checkups by the age of 20. So, once you are 20, so, you don't, there are certain tests, which you should start early, which would be like cholesterol test that you should start at 20. Then an HbA1c if you have a family history of diabetes. And in young women, especially pregnancy and all, also in young age, so we can get a CBC, complete blood counts done, because, an iron deficiency, low hemoglobin, that is very common. Then in women, we also recommend pap smear, pap screening test starting at the age of 21, because that's a screening test and it gives very good results in the long run and can prevent cervical cancer. Even in women, we start recommending, self-examination of breast. So that also we recommend. And if a person is obese, especially women, then we recommend getting your thyroid profile done. In women, young women, you can even have hormonal imbalances which can cause PCODs. So then there are certain hormonal profiles we recommend for them. Then as you age, usually we say frequent or regular health checkups more frequently from the age of 40. You can say that. That you would include, a lipid profile test. You can even go in for advanced cardiac profile like HSCRP and all. Then an HbA1c and blood sugar monitoring is important. Even a kidney profile test, a liver function test, after the age of 40, these tests become very important. Even a thyroid profile test is recommended, regularly starting from the age of 35. Then there are various, cancer screening protocols that we have. PAP screening starts early. Then also we recommend post the age of 30, HPV testing along with that. Plus, females can, get their mammogram done annually after the age of 40. In men, we recommend PSA screening levels for prostate cancers. Then if there is a family history of colon cancers, then even a colonoscopy starting at 45. Then in women, we see a lot of women suffering from osteoporosis. So then we also recommend a bone density scan, to get your bone density measured, and accordingly you can take precautions. Then a regular consultation with the doctors and getting your blood pressure checked annually, that also becomes very important. So basically, blood screening should start at the age of 20, and once after 35, 40, you should get it done more frequently. And, more number of tests get added as you age. And the more you age, the more frequently you would need these tests. If you have a family history or you have been diagnosed, then you would need these tests more often for the monitoring.
Ma'am, as you said, like somebody, usually we start screening at the age of 20, 21. You mentioned that. Now, if somebody doesn't know about their health before 20, are there any signs that might be indicative of health issues in an individual? Even before they start getting themselves screened, are there any signs that indicate that, yes, it's time that you get yourself screened to know if there are any risk factors?
See, usually if you are having these diseases in young, there would be a family predisposition, some genetic cause to it. That would lead to an early onset, let's say, of an early onset diabetes, if you say, or of a thyroid. So basically, there the family history starts to play a big role, because if you have a family history, it's then that these signs start appearing early. Okay, and see, these signs would vary depending on what disease you are having, right? If let's say you have a family history of cholesterol, high cholesterol, or diabetes, then accordingly, the symptoms which are associated with that, when you're putting on weight, or with diabetes, when you're having frequent urinations. So based on what family history disease you have, that can happen. So accordingly, we need to know if we have a family history, then we need to start screening early.
True, true. Now, again, if you mentioned about cholesterol. Now, what happens? What are the criticalities of having high cholesterol?
See, basically, cholesterol, see, our body does require it, but when it is in excess, it gets deposited in the blood vessels. So that would cause the narrowing of the blood vessels, which will lead to various cardiovascular diseases like stroke, heart attack, hypertension. Even in the body, it can lead to, deposition in the skin, tendons, to various xanthomas, cholesterol stones. Even in the peripheral arteries, it can lead to peripheral artery diseases. So basically, we need to monitor our cholesterol levels, eat healthy, cut down on junk food, exercise regularly, and to you know keep our cholesterol levels in check. As obesity can lead to a lot of complications in the long run.
And we've noticed that there are people who are like, who might be absolutely healthy. They look fit and healthy, but sometimes they internally feel as if they're down with, like they're down. They lack that motivation to work out, or they feel very low. Sometimes they lack that energy in them. Why does this happen? Like some days people might feel very happy, very motivated. They would like to go to work, enjoy. They're very lively, and there are days when people are like very down, gloomy, dull, and they just lose that energy. And sometimes it continues. It's for a long period of time that people feel like that. Why does this happen?
See, there can be various causes. It can be physical, or it can be even a mental or a psychological cause, which could be, leading to one feeling very tired or fatigued. So, the physical cause could be, not getting adequate amount of sleep, which could be due to some medical condition or due to stress. And nowadays, even a lot of excess screen time, really hampers your proper sleep. Then there could be certain nutritional deficiencies which can cause you to feel fatigued, like deficiency of iron, B12, essential nutrients, vitamin D, calcium. Then, so, if you're not staying hydrated during the day, that can cause you to feel very fatigued. Then there are certain medications also, if somebody is taking some medications like antihistaminics, that can be anti-allergics. So they can also cause you to feel sleepy. Then obese people can, there is a condition known as obstructive sleep apnea, where, while they are sleeping, suddenly they wake up because they're not able to, get proper oxygen. Then sometimes people, when they're not leading a very sedentary lifestyle. So that also, they're not getting adequate amount of exercise and all, can cause you to feel fatigued. Then various mental conditions where you are undergoing some sort of chronic stress or depression. So, there also, because you are not feeling mentally fit, so that can cause you to feel very, some days very low. So that could also be a cause. Then, sometimes when we overwork, we are working till late, we are having some shift working times, we are bringing work home. So nowadays, which, we're all working a lot, with. So that also, overworking and overburdening also can, because make you feel fatigued. So, it is very important that, sleep properly, take 7 to 8 hours of sleep, you eat healthy, you stay hydrated, and avoid excess screen time, taking breaks in between the work, to gain, freshen up yourself. So that is what you can do.
As you said, like taking break is very important, freshening up and maintaining a proper sleep routine. I think their audience, with most of us like trying to trying to balance our life, we forget that taking proper sleep is important. We are so busy with our professional life, working day and night, and the amount of like even students, young children, they have so much of pressure at school, and even college students, and obviously the corporate professionals and the working people, they have so much of pressure that they forget that they need that 8 hours of sleep every day, right? So it's very important that we keep ourselves balanced with proper sleep, and as you mentioned, hydrated. So, ma'am, how much water should one consume in a day, and what do you mean by staying hydrated?
The minimum of 2 liters to 3 liters, at least 2 liters. It can go up to even 5 liters maximum you can take, but at least 2 liters of water. And even too much of caffeine and all tends to dehydrate you. So you should actually even limit your caffeine intake and have normal water than taking too much of coffee and tea. So that keeps you well hydrated. Not your energy levels stay go proper. It keeps your skin maintained hydrated. So having and it just water will flush out the waste
Mhm.
from the body. So that is very important.
Ma'am, our audience who are watching us, they have a question.
Yeah,
So
I
here,
know. I've
there's a
seen.
question: which blood test would you recommend for a male in early 20s?
See, early 20s, male, I would recommend, if they are having some issues or testosterone levels, especially if somebody is having some issues. So testosterone, otherwise, yes, even a male can have a CBC, get their, hemoglobin levels checked because they can also have it due to dietary deficiency. Plus, nowadays, I would recommend somebody vitamin D and calcium, especially, uh, meals, calcium and vitamin D, in winters. And because we don't even take adequate sunlight, we're just sitting in our offices. So that also affects our bone health. So taking a vitamin, a lipid, and especially a lipid profile test, because
There is one more question since you're talking about the cholesterol levels. Ma'am, please talk about it. So yes, there if you could add a little more about cholesterol levels, the which are the optimal levels, and how to maintain it properly. So if you could just talk about
yeah.
that as well,
See, a
along with.
cholesterol test is basically going to, test for your total cholesterol, a triglyceride, HDL, LDL, and VLDL. These are the five things we test. So the normal levels of cholesterol should be less than 200, and for triglyceride less than 150. But in cholesterol test, when we test, we should have a proper fasting of around 9 to 12 hours. Now, ideally, HDL is known as a good cholesterol and LDL is known as a bad cholesterol. So, our aim should be that our HDL cholesterol should be in the normal range, preferably above 40, and LDL levels should be low. So, this is what we should aim for. And, we can do that, especially in young, if you say, by, eating healthy, having a proper balanced diet, avoiding junk food, fried food, a lot of saturated foods that we are eating nowadays, that frozen foods. Then, then you can exercise regularly, and that is very important. Staying physically active because we are leading a lot of sedentary lifestyle, so that becomes very important. So this is what I would say about cholesterol. And because it can lead to cardiovascular diseases. So that is why we recommend testing for cholesterol early nowadays.
There's one more question. Your winter is here, and everybody, I think, has this issue with skin. So there's a question: if you could suggest some preventive tips for skin in the cold weather. tips to keep our skin healthy?
See, firstly, you need to have good amount of water. That is important. Dehydration will cause dry skin. Then eating healthy is very important because in the skin, it requires various nutrients. So having a balanced diet becomes very essential. Having proper minerals, consuming proper vitamin C, you know, that becomes important. Vitamin C, vitamin E, so which you get in the vegetables and legumes, and eating that becomes essential. Then keeping your skin moisturized. That becomes very important in winters because the air is dry, so your skin dries up a lot. So, you need to keep it properly moisturized. So, this is what you can do in winter: staying hydrated, moisturizing yourself, and eating balanced diet.
Absolutely. So like that everything is there, and what there is a saying ki you become what you eat. So अच्छा खाने से that will show on your skin, and that will probably keep you
Yes.
healthy, not just externally but
And
internally.
proper sleep
True.
is also essential.
So that, as you already said, that like we feel lack of energy, that loss of energy that is there, that through proper diet, hydration, and proper sleep routine we can maintain, and that's very essential. I think everybody who's listening to us, it's very very important that you take proper care of these three things: that you sleep properly, you eat properly, you keep yourself hydrated, and you get yourself tested timely so you know how your body is reacting, how your body is functioning. That's very very important. So you also mentioned, when we spoke about the hydration part, there was a part where you said that taking too much of coffee is not very good. So there's a question: is it okay to drink coffee early morning? That's something even I had in mind, because I am a person who starts the day with a glass of coffee.
See, ideally, early morning, yes, we all do. But ideally, early morning coffee, especially empty stomach, it is always better to first have a glass of water because, you know, uh, you are going to cause yourself a lot of acidity and all problems in the long run. So first, I think what you should start your day is with probably with 2 glasses of water, and after that, having a coffee or a cup of tea with something, so you don't end up with gastritis and all. So you should actually start your day with 2 glasses of water before you actually take the
I think
coffee.
that is why, like, because instead of water, I start my day with that glass of
No.
coffee. I just take
So
hot
in the
water,
long
put
run,
coffee
you
into
will
it, and
cause
I start
yourself
my
gastritis and all that. So,
yeah.
so because the acid is piled up, so once you have the water or the acid, reflux the stomach, it touches down, then you can have your cup of coffee. And see, too much
Yeah, and there
of
are people who are addicted that they need like three, four glasses, or like that they have this cup out there, and then they fill in that cup with coffee and they drink throughout the day. You know, I've seen a friend who comes with this thermos filled with her black coffee, and then she keeps having that throughout the day. So that's also there. How does that impact
see,
the body?
tea, coffee, and all, they have caffeine. So basically, you are stimulating yourself. So why they get addicted is once you don't have, that your body gets used to that constant stimulation. So that is why when you're not having it, you feel, a little bit of fatigue. And too much of coffee in the long run is not good, having too much of caffeine. So I would recommend somebody not to have more than 2 glasses. Try to cut down. It eventually, slowly, slowly, you can cut it down because they are all habit formings. So that is what you should do. Then
There is
coffee or black
again, there's
coffee is
one more.
better.
Sorry. Which
Honestly,
is better,
black
milk or
coffee is any day better if you want to, because see, because it's caffeine, they all increase your metabolic rate also. So black coffee is any day better. And especially if you can have it
milk?
without sugar, that is even better because see, it's going to boost your metabolism. So in the long run, a black coffee is better than having a milk coffee.